Hello, my name is Jo Formosa from Health Dynamics, and one of the questions I want to ask you today is, are you looking at Medicine 3.0? What is actual Medicine 3.0? This is how to prevent disease. Many of us, or many doctors, if you go to your local GP or your local doctor, they are still operating in 2.0, Medicine 2.0, which is treating you for disease when disease happens. Not all the doctors, let me just say, I'm not going to put them all into one barrel because we've got some great doctors that we work with and partner with who are fantastic at running our clients' blood pathology. And the blood pathology that I'm going to talk to you particularly about is cardiovascular. And this is like a real myth that I see is people are wanting to avoid like heart attack or high cholesterol or cardiovascular, and especially if they have lost someone very near and dear to them, to what we call the very first symptom of cardiovascular disease, which is usually fatal, which is a heart attack. So 50% of people who have like this symptom usually die. So I know that sounds morbid, but that's actually the reality and the fact. So Medicine 3.0 is what we look at is how to avoid the actual disease from happening. So what is the number one risk factor for cardiovascular disease? Do you know? Like people will say it's smoking, it's bad eating, it's like stress, it's like blood pressure and all those types of things. It's none of them, actually. The number one risk factor for cardiovascular disease is age. And it's actually the number one risk factor for all chronic disease because as we age, our body has a different response of responding to it. But we've also had years and years and years and years of buildup of imbalances. And in this particular case, plaque in our arteries that if it's not constantly being like scraped out, it's like a plumbing system that builds up and it keeps getting junk. Then all of a sudden it smells or it blocks up or it pushes back. And then you go and put something to clear all the pipes or get a plumber in to do that. The same sort of thing happens with your car, but the car, you have a sticker that says take it in for a service. And we take it in for a service, we pay the mechanic, we get it back and we're like, sweet. But guess what? We don't have to usually do anything about that. So that's why that process is easy. But I want to share with you today something that I've learned, and we have been doing this for many, many years. And it's been so great to listen to a leader in Medicine 3.0, which is Dr. Peter Attia. And if some of you have not looked at his book, it's a book called Outlive. I recommend it to so many of my clients. The reason is it's because a book of longevity and it's about your lifespan and your health span. And one thing that Dr. Peter Attia is really for is making sure you're measuring these things in your body and having the ability to see the shift and change. So cardiovascular disease happens at the age of 30 and like it starts at the age of 30. It can even start even earlier than that, depending on your lifestyle and genetics and all those types of things. But it progresses over 10 years, 20 years, 30 years. So it takes about 30 years to really form. And then at the age of 60, 65, we see the most incidences of cardiovascular disease. And one of the lead factors, I talked about it in the last newsletter, if you haven't had a chance to look at that, is metabolic disease like diabetes, and that causes a lot of inflammation. But all these are inflammatory markers. But there's one thing, and you'll see in the article, I talk about something called ApoB. So it is a marker that you can get done. Most doctors do not do it. So you'll have your doctor, and you may have even said this the same. It's my good cholesterol, it's my bad cholesterol. That's also a myth. There is no good or there is no bad. So they say LDL is what shouldn't be high and HDL is what should be high. So they're calling those the good or bad. These are all transport markers, but there is another particular measurement or biomarker that we should be measuring that actually helps us to understand where those lipid particles are being stored and how they are going towards like the arteries as well. So let me just share with you my screen to give you a bit of an indicator, an idea of how this actually works. So this is what ApoB particle looks like. So you'll see in the document where I talk about LDL. Now, this is a little bit, technical, so just bear with me. So LDL is what we call, what the doctors or different physicians have called like that bad cholesterol. And they're looking at, it actually should be LDL-C. And it's looking at those particles of cholesterol But the main one that you want to have a look at is the ApoB. And the ApoB will actually tell us what ones of those particles of the LDL is actually being captured and being moved into the artery wall. And so this actual reference marker of ApoB, which most doctors do not do, definitely is important, because the LDL is like, it contains in the ApoB. So it's going to give you more information about that. And triglycerides is also a really good one, because if your triglycerides are high, then you have definitely got metabolic disease, or you have problems, dealing with breaking down your fats as well. But have a good read in the article, because I explained it all out step by step for you to really understand why the ApoB is really important reference marker to manage. So I'm just going to show you a client of ours, a 70-year-old woman. She came with high blood pressure and severe pain in her body. So lots and lots of inflammation. You'll see that there's usually a laundry list of things that people, and this is just one of the things that I'm talking about, but a laundry list of issues. She also has a calcium score, so you can get a CT scan done with just calcium score, which I'll show you her reference markers. But for her being 70, her whole thing is not to die of a heart attack, or to actually put her life in a way that she's in her best shape as possible. So when we get her actual report, you'll see cholesterol. They'll come to me and go, oh, the doctor wants to put me on statins. It's 7.6. My LDL is 5.44. So okay, so the LDL is 5.44. Okay, and this is classed as your bad cholesterol in the old language of metrics. And so therefore, doctors will want you to put you on statins, but statins can actually cause problems with dementia and Alzheimer's and things like that, because metabolically, and I mentioned it in the last newsletter, is the brain is also super important to make sure it's metabolic as well and able to clean up toxicity. So this is what we call another one, which is homeocysteine, which is another one. And I've talked about this before. Homeocysteine is an inflammatory marker of the heart. And there's inflammation, like there's ESR levels, there's CRP levels, and homeocysteine are three big biomarkers for inflammatory. We've got an inflammatory event this weekend, which we'll be explaining how inflammation comes. So if you have got inflammation or pain in your body, it's definitely one event workshop that you don't want to miss. So that needs to be about 8 or 9. So that's important. Now, B12 has a big component of bringing that down. So then we'd look at a reference marker of B12. But this lipoprotein A, and we're looking at different units of this as well. So just checking out her whole process. You can see that the coronary artery CT scan is 74.37. That's a total, right? So it's looking at the different arteries as well. Now, what's important here is this is looking at hard plaque. So we look at CT angiogram if we want to go a little bit more. I had a client of mine who we actually asked the doctor to do it. The doctor didn't want to do it. Doctor said, there's no reason, you're not at high risk. The client pushed for it. There was 3 arteries like nearly completely blocked. He had a triple bypass 2 weeks later because we pushed to do that test. So you don't have to have, like, heart disease does not give you any signs and symptoms. It's a heart attack, which is that as well. And by that time, sometimes it's too late. So this is the ApoB. So we're looking at a measurement. So you see here 1.3. Now for women, we want it under 1.4. So in this case, this client has the LDL is high, which is classed as what used to be classed as the bad cholesterol. But we're looking at how much of that LDL is sitting in this ApoB, and that's going to tell us whether she's more at risk factor. So in this particular case, we wouldn't put on statins, even though the total cholesterol is high. She's done detoxification program with us. We have cleaned up her diet. We've got the metabolism working, and already her cholesterol markers have come down, and her blood pressure is like done down to normal. And she is reducing weight even at that age as well. So you've got to look at the full picture, and you've got to start getting your doctors taking the proper blood tests, taking the right thing. So we've got some tips in the article as well of what to ask, how to become proactive in your health. Don't wait for disease to come knocking at your door. Be preventative. Be medicine 3.0, which is how do you prevent disease? How do you increase your lifespan and your health span? And this comes from education and knowledge of you taking those next steps. If you need any support or any questions, we know how to get those tests done as well. So you can contact us or reply to this newsletter, say, please help me with my test results, and one of our team will connect with you. Have a great day. Talk to you soon. Bye.